Thank you. On behalf of my colleagues at Ecog-Acrin, I'm pleased to present the primary results of Eaz171. This is a prospective validation trial of germline variants and taxane type in association with taxane-induced peripheral neuropathy, specifically in Black women with early-stage breast cancer. It's well established that Black patients have worse breast cancer outcomes. Not only are they more likely to die of their breast cancer, but also are more likely to experience higher rates of dose-limiting toxicities. Taxanes are the backbone of curative therapy in early-stage breast cancer and have the dose-limiting toxicity of taxane-induced peripheral neuropathy, or TIPN. This not only impacts patients' quality of life and their physical functioning, but also our ability to deliver planned doses of our life-saving chemotherapy. When we look back at prior trials we've done, we've learned a couple things. One is Black patients have significantly higher rates of neuropathy, and this is important because dose reductions of taxane therapy, the most common cause of which is neuropathy, are associated with reduced cure rates, specifically in Black patients. We don't see that relationship between dose reductions and worse cure rates in white patients. So here we have a disparity in a toxicity that's ultimately impacting equitable outcomes in breast cancer. When we look at genetics and we look at genetically determined African ancestry, we found that there may be specific germline variations that can modify risk of TIPN, including SBF2 and FKMR. Finally, prior trials comparing different taxane drugs have suggested that docetaxel is associated with less neuropathy and paclitaxel. This difference in rates of neuropathy between the two drugs is even larger specifically for Black patients and could be more important for them because they experience more neuropathy. So based on this retrospective data, Eaz171 was designed to prospectively validate those potential germline predictors of neuropathy, specifically in this patient population, and also to compare rates of neuropathy and dose reductions between the two taxane drugs. So the trial only enrolled women who self-identified as Black or African American and were planned to receive taxane therapy in the curative setting. They received either paclitaxel weekly or docetaxel every 3 weeks. We did find higher rates of neuropathy numerically in the high-risk genotype group, but this did not reach statistical significance in the total population or in either of the taxane arms. When we compared rates of neuropathy between the two taxanes, we saw significantly less moderate or severe neuropathy in the patients who received docetaxel, experienced by 25% of patients, that's in the dark blue here, compared to the patients who received paclitaxel, which is in the lighter blue. You can see that we saw this both when the toxicity was reported by the physicians and when the toxicity was reported by the patients. Importantly, we also saw significantly less dose reductions of therapy in the patients who received docetaxel compared to the patients who received paclitaxel. This was true when we looked at either dose reductions secondary to neuropathy or dose reductions secondary to any cause. So in conclusion, this trial did not meet its primary endpoint to validate the specific germline biomarkers of neuropathy in this population. We did see numerically higher rates of neuropathy in the high-risk genotype group, but that was not statistically significant. It's likely that those variants do contribute to neuropathy, but it's very multifactorial, and we need to look at more inherited and non-inherited factors in this population, and that work is ongoing with our group. This trial does have important implications for Black women with early-stage breast cancer, as we saw significantly less neuropathy and less dose reductions in patients receiving every 3-week docetaxel compared to those receiving weekly paclitaxel, suggesting that this may be the better taxane option specifically for Black women, for whom neuropathy is more common, severe, and impacts their disease outcomes. Overall, Eaz171 provided prospective assessment of TIPN using both physician and patient-reported outcomes and successfully enrolled only Black women with the goal of addressing clinically relevant disparate outcomes. We were able to successfully enroll to this trial due to involvement from Black patients and patient advocates and a successful social media campaign. The trial shows us that we can tailor research to the needs of underserved populations, and ultimately this trial succeeded because of the partnership with the patients it was designed to serve. Thank you.
Thank you, Dr. Ballinger. I think you've indicated here in your conclusion the reason this made it to the level of the PRESS program. We were very impressed with the ability to accrue to a study with several hundred patients of a Black-only population in early-stage breast cancer. We had, as you indicated, prior studies that had suggested in this underrepresented population that there were differences between the two drugs, but not enough patients had accrued to these studies to be able to statistically analyze it. So while your primary endpoint was not a positive endpoint identifying the high-risk genotype, I know you'll keep working on that. I do think you showed that the trends that we see in underrepresented populations deserve to be better studied in randomized powered studies. We can do this with other toxicities as well. I think that involving the community, as you did, was an important part of why you were able to accrue to this study. I think it is very clear that for peripheral neuropathy, docetaxel versus weekly paclitaxel has less peripheral neuropathy. There are other toxicities of these drugs, although this is one that has some very serious long-term effects. So we do rate the peripheral neuropathy benefit very highly. And there are other ways of giving paclitaxel, although this is the most common way to give it in the early stage setting. So ability to accrue and really look at something that was a trend that came out in an underrepresented population in prior trials is very important. And this was an Ecog-Acrin trial funded by our National Cancer Institute, and I think it's very important work. And I was the Asco expert on this one, I guess.